Welcome back to From Pediatrician to Primary Physician. Do you know how to book and attend your appointment with your new doctor? The next step in this process is booking the appointment. Using a narrowed down list of doctors, choose the one you feel will be the best fit for you. To book an appointment, check the doctor's website to see how the office handles bookings. Some offices ask you to book online and others require you to call, so check to see what the doctor prefers. When actually booking, make sure to ask about any concerns you have before the appointment. Questions to ask include, what do I bring to the appointment? It is best to show up prepared for the appointment to ensure that it goes smoothly when you arrive. How long will the appointment last? This will help you plan out your day and also learn the standard for the doctor. Knowing how long the appointment lasts can help you ensure the doctor is spending enough time with you. Also, ask if the doctor often runs behind. This can calm your worries while in the waiting room and give you a good estimate of when the doctor will see you. Additionally, ask for directions to the doctor's office. If the doctor's in a suite, it is good to know ahead of time where the suite is located in the building to cut down on the time it will take you to get there on the appointment day. Is there a patient portal? Most doctors function through a patient portal, which gives you access to your medical information. A patient portal keeps track of your test results, doctor's visits, prescriptions, and specific messages from your doctor. This is good to know because if they do, then you need to ask how to sign up for the portal. Can I bring someone with me? This is an important question to ask because unlike your pediatrician, some doctors do not allow others in the room with you. If the doctor allows someone in the room with you, then consider bringing a support person. Your first adult doctor's appointment can be nerve-wracking, so if you feel more comfortable bringing someone with you, then bring them. This support person can be a trusted person in your life and hopefully someone who can advocate for you if you for some reason cannot. If the doctor does not allow guests in the room with you, then remember it is nothing against you, but for them to ensure you can open up to them about sensitive issues you may not feel comfortable discussing in front of others. Remember, if you bring a support person, it is your choice how involved they are in your appointment. A support person ranges from someone who waits in the car for you, the waiting room, or even goes in the room with you. Lastly, ask if you need to book a specific type of appointment and what will happen during the appointment. Some doctors ask that you book a specific type of appointment for your first time to ensure they treat you properly. Asking what will happen during the appointment is also important because some first appointments are strictly diagnostic. Others can treat you immediately for your concerns, and some are a mixture of the two. The next step in this process is going to the appointment. At the appointment, make sure you get there early and have time to find the office and fill out the forms. Giving yourself time before the appointment ensures you have enough time with the doctor and are better prepared than if you're rushing at the last minute. When you get to the office, use the information we discussed in the first video to fill out your forms. When the doctor takes you back for your appointment, make sure to advocate for yourself. In the appointment, speak up for yourself. If you feel uncomfortable with something being discussed, then speak up to make sure you receive care that you want. A rule of thumb is don't let the doctor talk to you crazy. In other words, your doctor should be talking to you in a conversational way, not in a way that belittles you or is hard to understand. If you have questions on what a medical term is, ask the doctor so you understand what's happening to your care. The last step in the appointment stage of this process is the post-appointment analysis. After the appointment, decide if you would like to come back to that doctor in the future. Things to consider when deciding this are, did you feel comfortable? Your comfort is the most important part of this experience. If you felt uncomfortable by the doctor in any way, maybe look into another doctor on your list. In order for you to fully open up at an appointment, you need to feel comfortable with the person you're speaking to. Did I feel listened to? Did the doctor give you a chance to answer questions? You should feel your doctor is giving you their undivided attention in order to help with your concerns or illnesses. Feeling listened to is as simple as the doctor paying attention to you and your concerns. Did the doctor spend enough time with me? This time does not necessarily have to be the standard wait time the doctor spends with patients, but instead, whether or not you feel the doctor fully heard and addressed your concerns while in the room with you. Lastly, did you like the doctor but the wait was too long? If you really like the doctor, but the wait time was too long, you may want to give them another try. We all have bad days, so maybe the wait was not standard for them. But if the wait time was entirely too long and a deal breaker for you, consider another doctor. Most importantly, if the answer to any of these questions is negative, then it's time to explore another doctor. Do not be afraid to change for a positive experience. It will ultimately improve your health care. If you decide to continue care with that doctor, then make sure to schedule a yearly checkup with them. Nothing may come up in these appointments, but you will know what a standard appointment looks like for you, so if there's something wrong, you can address it. Well, that's it for this video. Don't forget to share this video, and this is from Pediatrician, the primary physician, signing off.